Hello everyone. I'm making this very brief video on a summary as to what it feels like to study in a med school and a brief insight into the clinical experience, pre-clinical experience, and some things you should keep in mind. So the most obvious thing that you will discover once you get into Italian med schools is that they are their foundation on theory is extremely strong. So their theoretical foundation is something they emphasize a lot in the preclinical years, and it's not compared to as it's not as weak as the American system or even other forms of European systems. So their theory is extremely uh, strong, and it's something they emphasize a lot in the preclinical years. Secondly, the most important thing is that you need to know how to follow a professor. So the most obvious thing is that the professor will not teach you everything. You're not expected to learn everything from a professor, although it's something that's commonly practiced in other medical schools. And in Italian med schools, the professor will tell you a certain book you have to finish. You have to, and the curriculum will be provided in some cases. In some cases, it's going to be rather straightforward, so it's not going to be as complicated. So you're expected to finish the book, and the exam is from the book. So, and the most important thing is that you need to know how to tackle and how to divide and how to take on that book. You need to. Some books are not small books. They're like 4 or 5 textbooks that you have to finish in a certain year. And it's really important that you know how to divide your time, you know how to divide and orient your time in order to finish a certain task. It's not easy, but you need to know how to do it on a daily basis. So for example, I do it, for example, there's a book for 600 pages, I need to finish it for my second semester. Second semester usually has 3 to 4 months. So what I would do is I would finish the book in 30 days, in 1 month. So for example, 600 pages divided by 30 would be approximately 20 to 21, depending on the rough length of the book. Then, after finishing the book, the most important thing is to revise the book, because reading is not the same as revising, and not everything sticks in your head. So you have to revise the book at least 2 to 3 or even 5 times to really get that much information. Some of the lectures will be straightforward, so the professor will be like, okay, study the lectures, the exam is going to be on the lectures. In most of the cases, that's not the case. It's not something that will be done. Yes, you will be lucky if the professor is like that, but that's not always the case. In addition, the clinical years. The clinical years, basically, as I said, it's founded on theory. The professors will give you a certain minimum hours that you have to attend for clinical sessions. Otherwise, it's not something that's given to you freely. But additional clinical hours are not discouraged. So if you want to do additional clinical hours, you are encouraged, in fact, and Italian professors and doctors are very encouraging, and they're very happy to see that students are more interested in them, and then they will give you tasks based on your level of keen interest in a particular topic. In fact, it's not common for local students here to go into the hospital in the 3rd year and experience as much as hands-on experience. However, international students they take advantage of the clinical experience, and then they also are, mainly because they're interested, and anyways, in addition, so if you want to if you're interested in research, because as I said, the Italian med schools are highly theory oriented, they're research oriented, and they will not teach you outdated stuff and something that's 300 years old. They will teach you research-based medicine, clinically research-based medicine. And if you're interested in research, you have research opportunities here. As you know, that for the 6th year you have to write a thesis, so you have to publish a thesis. You don't have to start a research experience in the 5th or 6th year. You can start it from the 1st year, even 2nd year, and the professors are very welcoming, and they will ask you, maybe they will interview you, look at your CV, and they will accept you in the lab. Of course, the professors won't pay you. It's not something that's, of course you're new, and you learn. So you're technically a student, not a lab worker. So it's something that the professors are very happy to help you with. They will teach you many things, and if you want to do research in the lab, and it's something they're really open to. So in short, Italian med schools are like, free for all, like do what you want, but at the same time you have tons of responsibility, and you have to be independent and very proactive, especially with learning.